All right. Welcome to the Sagewood Fitness lecture on exercising for heart health, February 2021. So we're going to talk about, are you getting enough exercise for your heart? So the ACSM, American College of Sports Medicine, and the CDC both recommend all healthy adults should participate in moderate intensity aerobic physical activity for a minimum of 30 minutes, 5 days per week, or vigorous intensity aerobic activity for a minimum of 20 minutes on 3 days a week. For strength exercises, resistance training exercises, they recommend that every adult should perform activities that maintain or increase muscular strength and endurance for a minimum of 2 days a week. Majority of the people here at Sagewood exercise 3 times a week for 30 minutes. And then on their own, we're hoping that they do a little bit more. Some people do our classes 5 days a week. But just making sure that you are doing a minimum of 30 minutes on 5 days a week, preferably to keep yourself and your heart healthy. So short bouts of physical activity can work towards this 30-minute goal as long as they are in a minimum of 10 minutes in length. So if you do 10 minutes in the morning, 15 minutes in the early afternoon, and another 10 minutes in the evening, that counts as getting at least 30 minutes of exercise, what we're looking for. But you can't break it up into like 1 and 2 minute segments. It needs to be at least a 10-minute long segment. And of course, you can exceed the minimum. You can improve your personal fitness, improve management of existing disease or conditions, and reducing this will help reduce your risk for health conditions or mortality. So obviously, the more exercise you do, traditionally, the better off you're going to be. And then aerobic activity, moderate or intense, should be performed in addition to activities of daily living, such as gardening, walking, cleaning the house, parking farther away from the grocery store, malls, all sorts of different things that just overall activity in our day. We don't want to necessarily say that that doesn't count, but it's not counting for what we're trying to get for the purpose of heart health as we continue. So moderate and vigorous intensity activities are complementary to providing health benefits. You want a variety of activities that can be done or combined to meet with the recommendations. So you don't always have to do the same thing over and over. You don't have to take the same class over and over. If you do the new step, one day you can do the treadmill the next, or the bike the day after that. Different things like that are going to accomplish the same goal. In general, more activity increases the likelihood of successful weight loss. So a lot of people, especially when they first move in, say, I've put on this, I've done that. Increasing physical activity, increasing amounts of physical activity will traditionally help with weight loss. The risk of injury for active and inactive persons occur approximately at the same rate. So don't think that, if I start working out, I'm going to hurt myself. Although that can happen, it definitely will be just as likely if you don't work out. So should never be a reason not to work out. And then flexibility is a key component. Each day you perform aerobic or strength training activities, take an extra 10 minutes to stretch your muscles. We traditionally stretch our muscles, for at least 5 to 8 minutes at the end of class. Give yourself that time to let your body cool down, have a couple drinks of water. That's always important too. And then when you are stretching, This says 10 to 30 seconds. I like to go a little bit longer. I think 30 to 45 seconds. With some of the bigger muscle groups, your quadriceps, your hamstrings, your back, those you can even go as long as a minute to a minute and 15 seconds. Really to allow those muscles to get stretched out afterwards will help minimize the soreness, help minimize the tightness. So we're going to talk about the benefits of cardiovascular exercise. And we're going to start with one of the most important things, blood pressure control. The more you do aerobic or anaerobic activity, you should have a better control of your blood pressure. Cholesterol control, both HDLs and LDLs. Weight management, again, we go back to weight loss, those kind of things. A big one that people don't always think about is stress management. So especially right now, with everything that we have going on, getting outside, getting your heart rate up, doing a little bit of walking will help with that stress management. Promote better sleep, promote more energy, and also chronic diseases. So will help reduce heart disease, diabetes, osteoporosis, and certain types of cancer. So are you at risk for heart disease? The CDC says males over the age of 45, females over the age of 55, sedentary lifestyle, no participating in exercise regularly, hypertension, systolic above 140, diastolic above 90, impaired fasting glucose above 100. So these are probably going to be a test. This would probably be a test that you get during your normal checkup that would test your glucose levels, or if for some reason you need to check your glucose level more consistently, then you would have that number above 100. Obesity greater than 30%. A family history, so that's a big one. Heart disease can definitely be attributed to family history. And then, which I don't think anybody here does, but smoking, currently smoking or quit within the last 6 months puts you at a higher risk of heart disease as well. So where should I start? What type of exercise should I do? How do I get things going? So myself, your NIF staff, will be able to evaluate your needs based on your health history, family history, doctor recommendations, and what goals you have set for yourself. So come see us. I know right now we're not able to, but when we get back open, most of you know that we do senior fitness evaluations. This is a great way to test your cardiovascular endurance. It also tests our anaerobic endurance in terms of bicep curls and some different things like that. So it's a great way to start to get an evaluation to see what type of exercises we can do to meet those needs and see what limitations you may have moving forward. And then, come, like I said, come see us, get a test done, senior fitness evaluation or an exercise prescription. We can start off from there. Traditionally, when we prescribe workouts, we're going to gradually increase your speed, generally 5 to 10 minutes in terms of a warm-up. It allows your body to direct blood flow, increase body temperature, lubricate the joints, and just overall get your body started, get warmed up. You don't just want to jump in. You never want to just jump on a treadmill and start running, at 85% of your max or 80% of your max. Let your body warm up, let your muscles get a little bit stretched, let your body get warmed up really to the point where it can, have a sustained amount of pressure. And then after you get done working out, again, stretching is a big indication. When you are doing your exercises, once we meet with you, once we figure it out, we can get you a heart rate indication, how many beats per minute, where should my heart rate be, how fast should I go, those kind of things. And we'll start going from there. Again, exercise at the designated intensity and the appropriate duration for the level of fitness. It's hard for us to just give that a generic way. And so we really need to look at things, find out where you're at, what you're comfortable with, what you've done in the past, those kind of things, to get this tailored to you. And then a cool down, so decreasing your exercise intensity, just like we don't want to jump on the treadmill and start going as fast as we can. We don't just want to stop and be done. Let your body cool down. Let your body, kind of understand the fact that you're done. Bring your heart rate back down to a normal level in an appropriate manner. Again, you just don't want to stop. You could get, it will help you avoid feeling faint or lightheadedness. And then if you do have questions, it's a little different with our PowerPoint presentations. You can email me at garrettmorgan@sagewoodlcs.com. And as we do get closer to having workouts again, allowing some of these things to start taking place, I would love to have you guys come down. I shouldn't say most, a lot of the residents here have done a senior fitness evaluation, have gone through our senior fitness testing. But it does give us a good indication at where you're at, what has been successful, what type of goals you might want to improve on, and just a good starting place overall. So if you have additional questions, please don't hesitate to ask. And again, we're going to continue to try and do these every couple of weeks, every 3 weeks, something like that. So look for these in the future with myself or another NIF staff. Thanks a lot and have a good afternoon.